The first testing instrument that I'd like to discuss with you is Dr. Wolfe's homeopathic test kit. Now, this is a very special test kit because it enables the dentist to particularly hone in on the condition that is the etiology of the patient's symptoms. I've developed 27 different homeopathic remedies and nosodes here that are indicators of the patient's particular problems. Everything from the components of amalgam to non-precious crowns to jaw infections, root canals, sensitive teeth, jaw pathology, decay, periodontal disease, infections. All of the homeopathic components in this testing kit are listed on the label inside of the lid. Whether you're testing for acute or chronic pulpitis, for sensitive teeth, or trying to determine if there's mercury underneath the crown, this testing kit is invaluable. Now, the way that we would test to find out which is the selected homeopathic is with a device that I developed called a scanner. The way that I administer these homeopathics is with a very special device, infrared device, that we utilize with the homeopathic in the nozzle, and I call it the photohomeopathic technique, where we put the homeopathic in the nozzle, insert it over the end of the infrared device, and this way we can infuse the energy of the homeopathic via the laser light into the patient's jaw and tooth. I'll demonstrate this along with the scanner with a couple of patients in the treatment room now. Okay, here we are in the operatory, and what I'd like to do now is demonstrate how we determine where the disturbance field is in the mouth. And we do this by muscle testing. Muscle testing is a way that we challenge the body's muscle strength and then interject a homeopathic remedy into the circuit and find out if it's going to make a difference in the disturbance field. Let me demonstrate how we do this. First of all, we have to get a baseline reading off the patient to find out where the baseline strength is. Make sure the patient has their mouth open, because sometimes when people put their teeth together, if they have a bite that's imbalanced, it will cause their muscles to get weak. We don't want that to be an influencing factor now. So go ahead and keep your teeth apart, and I'm just going to push down with a pressure that just meets her strength. You just ask the patient to resist your force. You're not trying to overpower them. You're just trying to meet their strength. And I will push with the same strength every time. Now, first thing I want to do is find out whether she needs to keep her teeth together or her teeth apart. So teeth apart, she's that strong. Teeth together, she blows out. So obviously in this situation, I would like the patient to have their teeth apart so we get a repeatable, reliable testing. So have your teeth apart, please, when I test you. Now the first thing I want to do is find out where the disturbance fields are. So what I'll do is see if there's anything on this side of her face, which there is. See if there's anything on this side of her face, which there is. And then also the front, anterior portion, which there is. Now let's just concentrate on this side over here. It's at the top, she blows out. The bottom, she blows out. So just taking this bottom as the lower right mandible as an area of concern, let's find out exactly what it is that's causing a disturbance field here. And to do this, we're going to utilize the homeopathic testing kit. Here's my testing kit. This has all the homeopathic nosodes and remedies that I would use to determine what is the factor in the mouth that is causing the disturbance field. First of all, we'll have the patient hold the handheld stylus in their hand. Now, we want to make sure that we're having a repeatable testing, so we'll have the patient touch an area that we think is probably a healthy area. Usually it's the lower anterior teeth, because these teeth are the least involved, usually have the least fillings, etc. Make sure there aren't any root canals. And just see if there's a strength here. In other words, you tell the patient every tooth in their head, you should be this strong when you touch it. See, we have an energy pattern here. We don't have a blockage of energy. So there's free flow of energy, and she's strong. Now, if we have the patient put their finger in another area of their mouth, like down here, she gets weak. So there's something here that's blocking energy flow. I don't know what that is yet. Let's have her touch this tooth right here. And she's weak there also. So let's use the homeopathic testing kit. And what we'll do, we'll use the scanner, and we'll touch some various homeopathic nosodes and remedies and see if transferring that energy in the wire to the handheld stylus assists her in being strong. Anytime that we're testing in the edentulous area where there aren't any teeth, the first thing that I think of is residual jaw infections or cavitations. So in the testing kit, those would be number 5, 6, and 7. jaw ostitis, acute and chronic bacterial ostitis. So I'll touch the scanner to the homeopathic no-so, and then we'll test again to see if that makes a difference. Okay, it's not number 5, that's jaw ostitis. Very much stronger with acute bacterial ostitis. Number 6. And number 7, not so strong. So we have number 6 that we have determined is a problem here. In other words, acute bacterial ostitis. She has an acute condition with the residual inflammation of the bone, residual infection. Now the tooth that we're concerned about here is tooth number 27. She gets weak. Let's see if it's a problem with maybe there's nickel in the crown. So I'll engage number 4. No, that's not it. Let's see if there's mercury amalgam underneath the crown. I'll engage number 1, number 2, number 3. No, that's not the problem. So in this case, of course, I don't have her x-rays present here, but let's engage number 8, which is root canal. This tooth has a root canal, and giving her the energy of the homeopathic for root canals assists the energy to flow, and that means that's what this challenge is, or this homeopathic would have been effective. So what we do is use an infrared device that will then insert the homeopathic into the nozzle, loading it in the nozzle, fitting it on the front of the infrared device, and this way we can infuse the infrared light through the homeopathic into the patient. The photohomeopathic technique utilizes the concept of the light integrating with the energy of the homeopathic and creating a combined energy that is even more powerful than either one of the two energies by themselves, and we have seen tremendous responses in the patients doing this. Let me demonstrate how this is used. Okay, first of all, we find the area of position that we want to infuse the homeopathic. Now, what we'll do, we'll have the patient hold the infrared device, and we'll position this to the area so they have strength that wasn't there before. In other words, the body is saying, yes, this is the area that it wants to accept the photohomeopathic. Okay, since we know that this is the area, and of course we can test that again to find out if that is the right area by having the patient go to the area, and without the homeopathic infrared device in place, they have a weakness. When we then apply the tip of the photohomeopathic device, then there's strength. Now, what we'll do, we'll turn on the light now. The light on the infrared device indicates the frequency of pulsations. What we'll do is turn on the interrupter, and we can dial in various frequencies of pulsations. And then we'll muscle test the patient to find out which frequency has the highest benefit for the patient. In determining which frequency is for the highest benefit of the patient, we utilize muscle testing. So I'll start with pushing on the patient's arm, and then I will turn on the interrupter, and we'll start going through a series of frequencies to determine where her strength is the strongest. As you can see, the frequencies are getting faster, but her strength is getting less. So we're going to then come back on the frequencies to the place that her strength is the highest. Right there. So we've got it positioned properly, and we've got the light flowing through the homeopathic at the frequency that's demonstrated to be for her highest benefit. 5 minutes later, let's test the patient to see the efficacy of this treatment. Now, we've had the homeopathic device in place for 5 minutes. Let's see now if this area where the patient was weak before, when we therapy localized, if they're holding the energy. And she is indeed holding that energy. This means that the meridian is flowing. So now, knowing that she's stronger, what does this determine for us? Well, now we know that in infusing the homeopathic remedy into this area has reestablished meridian flow. Now, we don't know if it's a long-lasting effect or short-lasting effect. We'll retest her next week and then determine what other treatments may be possible or necessary after that. In using the kit, we can determine if there's mercury underneath the crown. We can treat sensitive teeth. We can determine if there's nickel in the crown. We can find out exactly what the interference field is that's blocking the acupuncture meridian. And then we can decide how to administer this homeopathic in a non-invasive way with the photohomeopathic technique, or if we want to inject the oral vials or administer it orally. These are all options that we have that are non-invasive. Now, we may have to do surgery. However, if we administer the photohomeopathic technique pre-surgery and post-surgically, the healing will be that much more enhanced. Now we have another patient to demonstrate how I'm going to use the homeopathic testing kit. With this patient, we're going to be testing some different concerns than on the other patient. We're going to be testing for mercury fillings, and we're going to be testing to see if there's mercury underneath the crown. First of all, we need to find out the baseline strength of this patient. So teeth apart, please. And let's just see how strong they are. Just ask them to be strong and just meet their strength. Not trying to overpower them. Okay? Now teeth together, please. Okay. So he gets weaker, so we know that we should test this patient with their teeth apart, or we're not going to get an accurate test. Now we'll have him hold the handheld gram. And what we want to do is just demonstrate to the patient that they should be this strong on the lower teeth. Any tooth in their head, when they touch it, they should be this strong right here. Okay. Now, just to demonstrate how a mercury filling blocks an acupuncture meridian and is an energetic focus, let's have him touch a mercury filling on the lower right first molar. Okay. Now he gets very weak. You're trying to hold your arm up, aren't you? Very weak. Now, what we'll do is take the testing kit, and I will then, on number 1, 2, and 3, which are for silver amalgam, mercury, and copper amalgam, then put this into the circuitry and see what kind of effect that has. Go ahead and touch the lower tooth here. Okay. Now, he's weak right now, but when I touch the ampule of the homeopathic, he gets strong. Strong. Because now we have an energy in the circuitry from the homeopathic that counteracts the energy field of that mercury. Now, as soon as I let go of the homeopathic, he gets weak. But when I reconnect it, he's strong. Now, something else that we can do with the mercury ampules, he has a gold crown up here on the upper left. Let's see if this is an interference field. See, he's weak when he touches that tooth. That tooth is on the stomach and spleen acupuncture meridian. Now let's see if there's mercury or amalgam underneath that crown. So we'll engage number 1. He's strong. Number 2, strong. Number 3, strong. So we can discern that there is mercury underneath this crown, or these homeopathic remedies would not have been effective.